Marshall Amendment number 2 regarding FDA guidance, which we believe will promote the development of non-opioid alternatives for acute and chronic pain management. Leading this amendment was Senator Markey. I appreciate his efforts and support as well, and this is modeled after legislation that Senators Shelley Moore Capito and Marsha Blackburn have worked on as well. When I think about the situation now with the lack of new alternatives, non-narcotic alternatives to pain management, I went back and did some history research. Acetaminophen, Tylenol, was discovered in the 1870s. Ibuprofen, which we now would call Advil or Aleve, discovered in the 1960s. Toradol was a new miracle drug that was approved by the FDA in 1989, but has limited use because of its side effects. And in my clinical history, I can't think of anything else significant, any miracle pain medicines that are still on the market that have come since 1989. Vioxx was taken off the market, some of those types of drugs as well. We've seen no improvement now in, goodness, 50 years on non-opioid management of pain. So our legislation tries to address that. The pharmacological industry relies on the FDA to provide rules of the road to get approval for various therapy classes, whether it's Alzheimer's, COVID vaccines. We need that same type of guidance when it comes to these non-narcotics. They're called guidance documents. So based on these documents, innovators and their investors decide how to proceed or not at all. Drug development, as I pointed out, has been extremely difficult for innovative pain medicine. According to the industry report, there's only a 2% probability of an FDA approval from phase 1 compared to the 10% success rate of all other disease medicines. The 2018 Support Act required the FDA to foster the development of novel analgesic drugs by assisting sponsors with the development of non-opioid alternatives for acute and chronic pain management. Unfortunately, the FDA has not fulfilled this requirement. It's only produced draft guidance for acute pain. So that stymies the research. Our amendment holds the FDA accountable. That's our job. Our job is to hold the FDA accountable. It reinforces the requirement to publish guidance for non-addictive drugs that treat chronic pain. This is the greatest opportunity to avoid long-term opioid use and risk of addiction, especially for the 16 million Americans with chronic lower back pain who worry about overusing opioids. These patients don't want to use the opioids, but they don't have any other good alternative out there. I believe that American ingenuity will one day make opioids a thing of the past. We can help pave a brighter future by encouraging the pharmaceutical industry to continue taking risk. We hope you'll support our amendment. Thank you.